Good afternoon. Today is Tuesday, March 31st. I'm Jim Weatherup, Chairman of the Oswego County Legislature, joined with Nicole Colmsey, our Director of Community Services for the Oswego County Division of Mental Hygiene. We've all been under additional stress and anxiety over the past few weeks. Nicole will share important information about resources in the community and ways that we can reduce stress and anxiety. Nicole?
Good afternoon. My name is Nicole Colmsey. I am your Oswego County Director of Community Services. You've been hearing a lot of numbers being reported every day. I'd like to speak to you a little bit about a different set of numbers. Those numbers not being those individuals that are ill or those that are quarantined. I want to tell you about the hundreds of people locally and the thousands across New York State who are available to help you and your families get through this crisis. These individuals are not just dedicated and caring professionals. They are also your peers, people who share some of the same life experiences as you do. The COVID-19 crisis is a life-altering experience that we all share, even though we may react and manage that crisis very differently. If you are struggling in any way, please reach out and talk with someone. This person that you might speak to might not have the exact same struggles that you're having, but they will know firsthand the reason for them. Talk with one of these many people who want to help you. Many of us have never experienced a situation that has so vastly devastated and disrupted our daily lives of everyone that we know. And this being for a sustained and an uncertain period of time compounds that level of anxiety for so many of us. Whether you are struggling with meeting the basic needs of your household, managing your anxiety or your emotions, if you're struggling with at-home schooling, accessing routine health care, caring for those who are vulnerable, or treating those who are ill, we are all in need of additional support and kindness and resources at this time. There are warm lines and helplines and hotlines for you to call. Some people might not understand the differences between those. So the warm lines, just to give you a better idea, are for individuals who need some supportive connection to another person that will help them to understand a little bit more about what's going on during this period of isolation and reduced service availability. They can also provide you with information on resources that are available in your home community. You can call and talk and just chat, talk about your day, ask particular questions, or where to go to get more information. Hotlines and helplines are for people who are experiencing an emotional crisis. When what you are experiencing is more than you feel that you can manage, it's appropriate to call one of the hotlines or the helplines that have been posted. Those are staffed with mental health professionals who can help you assess your mental health status and needs and be able to link you to the appropriate services and interventions that you might need at that time. To learn about available supports and resources, please visit the mental hygiene page of the county website at www.oswegocounty.com/mental hygiene. You may also call the division phone line to access that information, to request specific information that's available. If you need to, please leave a message and someone will promptly return your phone call. The phone number to reach the mental hygiene division is 315-963-5361. You may also call 211. Our local Department of Social Services is working to coordinate with 211 CNY to keep them up to date regarding basic needs resources available in Oswego County. Please remember that anxiety is a normal response to a stressful situation and oftentimes can be helpful. However, if you are experiencing prolonged feelings of hopelessness or thoughts of self-harm or suicide, I urge you to seek help immediately. Mobile crisis teams and 24/7 crisis phone lines are available. Call Crisis Connects at 315-251-0800 or visit the mental hygiene page of the county's website for additional crisis hotline and text line information. That website is www.oswegocounty.com/mental hygiene. Please know that your local health and human services agencies and county departments are adapting, reallocating staff and resources on a daily basis to meet the current and changing needs of Oswego County residents. We will all help one another get through this together. Please stay safe and stay home, and please stay connected. Thank you.
Thank you, Nicole. Again, I want to reinforce with you that our health department is following all the proper procedures to isolate, monitor, and assist infected patients. We need everyone to do their part to help slow down the spread of COVID-19 in our community. We can help limit exposure if we all work together. Please stay home as much as possible. Avoid non-essential gatherings of all types and sizes. Keep 6 feet from other people. Wash hands often with soap and water for at least 20 seconds, especially before eating. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home if you are sick. Cover your cough or sneeze with a tissue and then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. Call your healthcare provider from home if you are experiencing symptoms such as a fever, cough, or shortness of breath. Do not go to urgent care or an emergency department unless you are experiencing life-threatening conditions. Please continue monitoring reliable sources of information. Go to OswegoCounty.com for the latest news releases, daily updates, and video presentations. Visit the mental hygiene page for a list of community resources. Additional questions can be directed to the Oswego County Health Department COVID-19 hotline at 315-349-3330 or the New York State COVID-19 hotline at 1-888-364-3065. Thank you again for your cooperation. We are all in this together.